Welcome. You're listening to the Leading Health Podcast by the Kansas Health Foundation. We have a bold vision to make Kansas the healthiest state in the nation. And it's not just a vision, it's a movement powered by people like you. You are one of the 30,000 Kansans invited to help us shift our state's future. We're your hosts, Ed O'Malley and Susan Kang.
In each episode, we move beyond the usual conversation about health, the doctors and deductibles. Instead, we talk about capital H health, our ability to thrive. This is your invitation to grab the Leading Health book and join the conversation as we work together to make Kansas the healthiest state in the nation.
Welcome to another episode of the Leading Health Podcast. It's when my colleague Susan Kang and I, my name is Ed O'Malley, walk you through this book, Leading Health, How You and 30,000 Kansans Help Communities Thrive. Susan, we're doing a little bit of a different kind of episode today. We've done 5 episodes. We've walked through kind of the first part of the book. We're about to, in our future episodes, get into the second part of the book. Today, we're kind of doing a little bit of a bridge, a little bit of pause, aren't we?
Yeah. I think that's important to have our listeners to understand where we've been, a little bit of a recap, and then a little bit of a preview about what's to come.
Yeah, we've had 5 episodes. We were joined by Teresa Lovelady for one of those episodes. She is the CEO of HealthCore Clinic here in Wichita. We were joined by Carrie Bruffett in another one of those episodes. She's the CEO of the Kansas Health Institute. And we were joined by Kenny Wilk in our last episode, who works for the University of Kansas Health System and a longtime civic official in Kansas in lots of different roles. And a lot of conversation in part 1 of the book and part 1 of the podcast series, those first 5 episodes. A lot of that conversation was really saying, hey, like what's going on with health in Kansas, right? So we know this by now. We made an argument about capital H health versus lower H health. And by the way, if you're listening and you didn't catch that, go back to episode 1 where we really dive into capital H versus lower H health. And we talked about the 30,000. The focus of this book, the focus of this podcast are those 30,000 Kansans who hold roles of civic authority. They're elected officials, pastors, university presidents, school principals, nonprofit executives, community-minded business CEOs. We talked why did we kind of like target those 30,000 and what's the role they need to play? And we got into a great conversation, didn't we, about America's health rankings? I know it was one of your favorite topics.
No, absolutely. Absolutely. I think that is we're using that as our North Star, right, to measure progress on our journey to becoming number 1 in the nation.
But as we go into part 2, if part 1, here's a simple way of thinking about this, maybe leaning a little too heavily on a medical metaphor here, but part 1 really of this podcast, part 1 of the book, really describes the symptoms. Like part 2 is when we're going to give a diagnosis. Okay. And part 3, which we'll talk about later, is where we really outline the prescription. Okay. So how's that? I'm not a doctor, but how's that for a medical model, right?
I know, exactly.
Pretty clever,
exactly.
Huh?
Yep,
Thank
absolutely.
You. Right. So with part 2, we start part 2 by in essence saying, passionate people, not in essence, literally saying, passionate people working for change are often their own biggest enemy. And we go on to describe in this little kind of in between chapter 5 and chapter 6, we have this little kind of introduction to part 2. And we describe some examples of Kansans, members of the 30,000, working for like their thing. So the first example is about an advocate for the homeless. And the second example is about a Speaker of the House. And the third example is about a business executive, like working to do their thing at improving Kansas. But then we talk about how, like in these examples, the real challenge was different than it first seemed. And this is always true, right? Like those of us, all of us listening, Susan, you and me, we've all had times where we end up working on something and what we thought was going to be the key to progress wasn't the key to progress. It was something else.
Right.
And that's certainly alive and well as we try to mobilize Kansans to close the health gap. And what we're really saying is we tend to think that the health gap, closing the health gap, we tend to think that climbing the health rankings, getting to number one, we tend to think that the slide in health from our high water mark of number 8 to our low water mark of number 31, we tend to think of all that as a health stuff.
Mm-hmm.
That it's a health challenge.
Yeah, I mean, I totally thought that until the book.
Right.
Yeah.
Yeah. If there's a moment of suspense in the book, which it's not a thriller, but it's really the moment of surprise or suspense is part 2, where we in essence say, this is not a health challenge. It is a leadership challenge. That's what this is. And if we think of it as a health challenge, we'll try to solve it in one way.
Yeah.
If we think of it as a leadership challenge, and specifically a leadership challenge for the 30,000, most of which are not doctors or nurses or hospital executives or public health experts, right? If we think of it as a leadership challenge for the 30,000, we'll go in a different direction. We know, based on our work at the Kansas Health Foundation, improving capital H health is a leadership challenge. Climbing America's health rankings for our state and getting to number 1 is a leadership challenge, and it's a challenge specifically for the 30,000. That's what we talk about in part 2.
Right. And add to that it's an adaptive challenge. This is not a technical challenge. And there are many things that go with that notion, right? The fact that it's an adaptive challenge, that it involves risk, it involves loss, it involves further exploration. There's no easy answer.
Yeah, somebody, I talked to somebody the other day who had read the book, and they said, Ed, I see what you did there. That was really clever. You wrote a health book, but you snuck in a leadership book inside it. Yeah. And that's absolutely true. I mean, by design, that's what we did. And so part 2 is where we are parsing out, why is this a leadership challenge? And we're sharing a lot of information about the nature of adaptive challenges, which proving capital H health is an adaptive challenge. We're sharing a lot of information about the nature of those adaptive challenges and connecting those characteristics of adaptive challenges to this challenge of the health gap in Kansas. I think people are going to enjoy the section, part 2. There are, I can't remember how many chapters, maybe 5 or 6 chapters in this part of the book. I think there's a lot of provocative ideas. I think there are some topics that are going to piss people off a little bit. The way we talk about leadership, for example, we don't think leadership happens very often. We think it's incredibly rare. Mm-hmm. We think most of us don't do it. And there are a whole lot of people in the 30,000 who get called a quote unquote leader, and they think of themselves as a quote unquote leader, and they might be challenged by the way we're saying, look, we actually don't like the L word. We like to talk about people exercising leadership.
Right.
It's an activity. It's not a position. So it's a provocative part of the book. I'm excited to get into it with our podcast guests over the next several episodes. It'll be a lot of fun.
Yeah. What I would say about this book for me and how it lands, and frankly, what we do at Kansas Health Foundation is a different way of doing. So in other words, we look at health, people have looked at health as a health issue and how to solve, maybe using some quick fixes as to how to get up in our rankings, if people are even thinking about that. But, how to do quick fixes. But I think what's really, really resonant for me is that we're looking at this from a different lens. And part of framing this as a leadership issue as opposed to a health issue really does so much for me to think differently, right? And to try different experiments and try to look at this issue differently in an effort to come to a different conclusion, not the same old conclusion that we keep coming to around health, which is basically getting nowhere. So that is what I'm really interested in diving into around this book.
Susan, for 35 years, one interpretation would be for 35 years, people in Kansas who knew about the slide in the health rankings, knew that Kansas was one of the healthiest states, number 8 at one point, and fell as low as number 31. That was 4 years ago now. That for 35 years during that slide, which is a persistent slide, right? That we believed that this was something to leave to the medical experts and the public health professionals. Now, those people have a part to play, and their part is very important. And the Kansas Health Foundation and Susan, you and myself, we are huge fans of medical experts and public health professionals. But their part is just a part. And even if we close a little introduction to part 2 with this paragraph, even if all the experts on healthcare, public health, nutrition, fitness, and wonder drugs do their part, the health gap will remain. That's because the health gap is first and foremost a leadership challenge for the 30,000. It's going to be fun getting in this with our guests, with you, Susan. We'll have a lot of great conversations. It'll be a good time.
We're going to have a lot of fun.
All right, everybody. Thanks for joining us for this little mini episode of the Leading Health Podcast. Hope you join us next time when we dive into describing how this is a leadership challenge, not a health challenge, in more detail. Thanks, everyone. Take care. Thanks for listening today. Before we leave, there are a couple ways you can help. The first, visit kansashealth.org/leadinghealth to claim your copy of the book and join in the efforts as we work together to make Kansas the healthiest state in the nation. The second is to share this podcast with your network. Also, we'd love to hear from you. Drop a comment from whatever platform you use to get your podcast.